Corns and calluses. Corns and calluses. Description: Corns and calluses are thickened areas of skin due to repeated pressure, friction, or irritation. Corns are well-defined horny papules or nodules that are often painful when pressed. Calluses are poorly defined areas of thickened skin that may be painful if cracks develop. Treatment is typically conservative, consisting of soaks, gentle exfoliation, moisturizing creams, topical keratolytic agents, and padding. Large and/or painful lesions may require scalpel debridement or surgical removal. The underlying mechanical cause, for example poorly fitted shoes, underlying foot and toe deformities, must also be addressed to prevent recurrence. Etiology of corns and calluses. Corns and calluses are actually hypertrophy of the stratum corneum. Hypertrophy of the stratum corneum is secondary to repeated pressure, friction, or irritation. It is caused by poorly fitting shoes, manual occupations or hobbies, for example in weightlifters and musicians, foot deformities and toe deformities, for example hammer toe, hallux valgus. Clinical features of corns and calluses. General findings: corns are well-defined, circumscribed horny papule or nodules. They have lighter colored, cone-shaped keratin center. They are often tender when directly pressed, as opposed to plantar warts which are tender when squeezed on the sides. Skin lines are present over the lesion, as opposed to plantar warts in which the skin lines go around the lesion. Hard cones. Hard cones have a deep, firm central core, typically located on the tops or sides of toes or the ball of the foot. Soft cones. They have macerated appearance. They are typically located between the toes. Calluses. Calluses are poorly defined areas of thickened skin, typically located on the hands, fingers, or feet beneath the metatarsal heads. Skin lines are present over the lesion, painful if cracks or fissures develop. Diagnostics. Corns and calluses are primarily a clinical diagnosis. If there is diagnostic uncertainty, debridement or skin biopsy to exclude alternative diagnosis. Consider imaging if there are associated toe deformities. Differential diagnosis: hard cones on the sole of the foot are often mistaken for plantar warts. Clinical features of plantar warts include tenderness when pressure is applied to the sides, absence of skin lines. There are no skin lines in warts. That is, the skin lines go around the wart, a central brown or black dot, and bleeding with debridement. Soft cones are often mistaken for tinea pedis. In cones, there is a lighter colored center, and skin lines pass through the lesion of cone. In warts, there are black or brown dots in the lesion, and skin lines do not pass through the lesion. Treatment: initial management. In all patients, initiate conservative management. Recommend warm water soaks followed by exfoliation, for example with a pumice stone. Encourage the use of moisturizing lotions, creams, and/or emollients. Consider an over-the-counter topical keratolytic agent, for example salicylic acid, urea. Apply padding, for example cotton gel foam, to the affected area while it heals. In large and/or painful lesions, offer additional management: scalpel debridement. Hard cones refer for surgical interventions, for example corn enucleation, surgical excision. Patients with diabetes should not attempt to soften or treat cones and calluses themselves because of the risk of diabetic ulcers. Refer to podiatry for management. Ongoing management and prevention of recurrence. To remove the underlying mechanical cause and prevent reaccumulation of hyperkeratosis, initiate the following. All patients continue conservative interventions, for example intermittent exfoliation, routine use of moisturizers with mild keratolytic. Refractory or recurrent symptoms, refer for specialist evaluation. Podiatry orthopedics may need to correct any underlying deformities or fit the patient for custom orthotics. Wound care specialists can offer additional modalities to improve healing. If there is hand involvement, recommend using gloves or protective pads during activities that involve hand friction. Foot involvement. If there is foot involvement, recommend a shoe assessment to identify and correct poorly fitting shoes. Keep toenails trimmed. Thank you. Like, comment, share, and subscribe.